Thank you for joining us as we walk through our Shop for Plan demo. We're going to meet Sarah Brown, a 35-year-old marketing professional living in Illinois with her husband Joe and 8-year-old daughter Jennifer. She's pregnant with their second child, due in June. It's November, which means it's open enrollment season for her employer-sponsored health plan. Since Joe is a freelance writer without employer-sponsored health care, Sarah typically covers her family as dependents under her plan. Although she is in good health, Sarah expects to rely heavily on her health benefits this year, with the new baby coming in June, an asthmatic daughter, and an accident-prone husband. She knows costs have gone up considerably since she had Jennifer in 2007 and wants to understand which plan provides the best value for the level of flexibility they want to preserve. Sarah goes to her employer-sponsored health plan portal to explore her options. From the landing page, she is able to shop for a plan. Because Sarah is a registered member in her second year of employment, she has a user ID and password, which she uses to log on. This brings Sarah to her personalized dashboard, a place where Sarah has easy access to manage her family's health across several dimensions. This end-to-end integrated solution helps Sarah stay engaged in her health and enables more informed decision-making overall. From her dashboard, Sarah can interact with and manage her family's healthcare providers. She can track her fitness activity by integrating a Fitbit or an Apple Watch, engage in dialogue with a community of parents raising kids with asthma, and even ask Watson to help her solve some of her most challenging questions. Sarah can also understand her health benefits spend this year and is able to drill down into claim level details. She even has a set of recommendations based on IBM's Next Best Action analytics, helping her stay on top of her health. Of course, all of Sarah's interactions are tracked with IBM's digital analytics, helping our clients better understand and connect with their consumer base. Sarah navigates to the prominently featured banner, inviting her to enroll in her 2016 benefits. Sarah is now shown options to begin her benefits enrollment. She quickly confirms that she'll again be shopping for her whole family. Since we already have rich data on Sarah's family, we can simplify the experience and recommend coverage to fit her needs. We can even integrate insights from Sarah's Twitter account to understand products that she might be inclined to purchase. She sees her family's current coverage and has the option to begin shopping for multiple different types of coverage. Sarah decides to get started with her medical benefits enrollment. Sarah now sees a list of her preferred health providers. She has the option to make changes to her preferences for 2016 and decides to add the OBGYN she plans to see during her pregnancy. Sarah indicates that she does want to make changes to her healthcare team and is prompted for more information. She enters in the name of her new doctor, and her zip code. A set of search results is returned based on her criteria. Her doctor is the first listed, so she selects to add him to her healthcare team. This is an opportunity for clients to apply IBM's provider-patient match solution to help steer consumers to providers with the best outcomes for patients like them. She gets a confirmation back, and feeling satisfied that her healthcare team now contains the doctors and facilities they prefer to frequent, Sarah continues on to the next step. Next, Sarah is shown her family's historical health benefits expenditure, breaking out costs into several categories. She also has an option to add in new conditions for consideration in her 2016 benefit spin. Sarah selects that her 2016 needs will be different from those in 2014 and 2015 and opts to add in a condition. She types in pregnancy and chooses to see the average cost for her condition. Since we already know Sarah's medical history based on her claims data, we can confidently provide an estimate for a healthy pregnancy based on people like her. Sarah learns that she can expect a healthy pregnancy in her geography to cost $12,775 and decides that she wants to include that cost in her 2016 health plan selection. If we did not have such rich data on Sarah, or if Sarah had a complicated scenario she wanted help navigating, we could even apply our Ask Watson solution to provide personalized results. Now she sees a list of choices available to Sarah and her family, prioritized by best fit in accordance with stated preference and availability. It provides a clear picture of the monthly premium, her estimated out-of-pocket expense, and the type of plan. She can refine her criteria using the left panel of options to narrow in on the best plan for her family. To make things even simpler, HealthView provides a best fit recommendation tailored to Sarah's family's specific needs. Sarah can choose to read the logic for that plan's recommendation. She can also read more about how her costs were estimated utilizing IBM People Like Me capabilities that derive projected benefit needs for families like hers. Satisfied with the search results, Sarah decides to compare the top two plans. On the compare screen, Sarah can now review additional information and a convenient side-by-side comparison on her two best fit plans. In addition to seeing plan type information, Sarah can easily understand the coverage and costs under each option. She sees that the PPO with HSA has a lower out-of-pocket maximum, and while the monthly premium is greater, her estimated out-of-pocket expense is lower. She sees key information on copays and coinsurance as well as prescription coverage. Based on this comparison, Sarah feels confident that the PPO with HSA is in fact the best plan for her family. She clicks on the plan to drill down another layer just to validate her decision. Now Sarah can see an even lower level of detail specific to the PPO with HSA plan. She is able to see the split between in-network and out-of-network coverage on a variety of key categories. She can understand the cost of brand and generic prescriptions and even read more about other services offered. If Sarah wanted to understand even more information about the plan, she could even open up the summary plan documentation. Sarah is satisfied with her selection and decides to confirm her selection of the PPO with HSA plan. Sarah now has the option to continue with her open enrollment or to check out for her medical plan. Sarah decides that she wants to go ahead and pay for her first month's premium. Based on our next best action, HealthView now recommends that Sarah shop for life insurance, based on the greatest opportunity to capture Sarah's interest. Sarah reviews the information about her dependents and selection before entering her credit card information. This brings Sarah to the final step before she submits her payment. On the summary page, she validates the payment information before finalizing the payment. Once she confirms everything is accurate, she selects Next. Now Sarah sees confirmation that she successfully paid for her first month's premium using our secure and proven WebSphere Commerce solution. Again, she is prompted to continue with enrollment. She is also shown recommended services for people like her. She can either email or text herself a copy of her payment. Thank you for watching our Shop for Plan demo.